Hi,
Hi.
I'm Annie. I'm going to be your nurse today.
Hello.
I'm going to be doing a full head-to-toe assessment on you today, okay?
Okay.
Can you tell me your first and last name and date of birth?
Laura Lord, March 1st, 1982.
Great. Laura, can you tell me where you're at and what time it is?
I'm at Jefferson Regional Medical Center in Pine Bluff, Arkansas, and it is 7:47
Okay.
p.m.
Laura, I'm going to wash my hands. I'm going to don some gloves. I'm going to shut the door. Everything in here is completely confidential. I'll be providing you privacy. If you're ever uncomfortable or you need to ask me questions, just let me know, okay? This head-to-toe assessment could last around 20 minutes, maybe a little longer, maybe a little less. First thing I'm going to do is check your vital signs, okay? So I just checked them, and your vital signs are 120/80. Your heart rate was 85. Your respirations were 18. Your temperature was 98.5 orally. And your pulse ox was 100%. All those are completely within normal range, okay? Now we're going to inspect your skin and your nails. No skin lesions or tattoos. I would inspect each hand one at a time. So there's no clubbing, no abnormalities. Your nails are smooth. Your skin isn't dry, there's no excess moisture, no unseen lumps or bumps, no clubbing, less than 160-degree angle. Your nails are trimmed, they look very nice. Your tissue around the nails are pink, no edema or swelling or anything. Temperature is warm to the touch, and the same bilaterally, okay? No tenderness, nothing like that, right? Okay. So I inspected your fingers, now your toes. Your capillary refill is less than 30 seconds, no clubbing in your toes. The temperature is warm to the touch bilaterally. No swelling or edema or tenderness, right? Okay. So now we're going to check your head and your neck. Your skull shape is normocephalic. Let's see, your color is blonde. No parasites or lesions. It's moist. It's not dry. It's flat. It's evenly distributed. It's pretty thick. Your face. The uniformity, the skin color is pink. Facial features are all symmetrical. Your eyes are on the upper third of your face. Your nose is midline. Your mouth is on the lower third of your face, and your neck is symmetrical. So now we're going to assess your carotid arteries. We would palpate them one at a time. And then we would auscultate with the bell. This is a cardiac stethoscope, so it's a little different than a normal one. In order to listen with the bell, we would just squeeze a little harder. So I would auscultate one at a time, and I would have you hold your breath. Okay? So your carotid pulses are strong, they're equal with regular rhythm and without bruise. If you have a bruit, that means that you have some kind of plaque in your arteries or a narrowing of the vessels. Which you don't have that. Now we're going to palpate and state your lymph nodes, okay? So if you can just turn this way a little bit. This is going to be your pre-auricular, your post-auricular, your submandibular, your submental, your occipital, your tonsillar will be right here. Your superficial cervical is right here. Your anterior cervical is right here. Posterior cervical is right here, and your supraclavicular is right here. And in order to feel for your deep cervical, we would do them, one at a time, but just a little bit deeper. And none of your lymph nodes were palpable, which is good. Okay. Next, we're going to assess your eyes, ears, nose, and throat. When using an ophthalmoscope for your eyes, this one doesn't work, but it works for the time being. We would look for a red reflex in the eye or structures in the ocular fundus. but your pupils are equally round and reactive to light. No redness, swelling, nothing like that. To your ears, they're both symmetrical. You have one piercing bilaterally in each ear. They're warm, without lesions, elastic, with immediate recoil, no tenderness over the auricle, tragus, or mastoid process, right? Great. And in an adult, the pinna, we would pull it up and back. And with our pin light, we're going to assess the outer ear canal, and it doesn't have any foreign bodies. There's not any cerumen or earwax and present. So when using an otoscope, which we have, we would pull the pinna up and back for an adult and look in the otoscope for a nice gray tympanic membrane, which it looks great, it's shiny, so that looks normal, okay? Let's go to your nose. It's midline on the face without deviation, patency of the nares. Your frontal and maxillary sinuses are without tenderness. Can you feel any tenderness? Great. Your lips are symmetrical. They're pink, moist, and without cracking or any lesions. So, using my pin light, I'm going to look at your buccal mucosa, and your teeth, gingiva, your cyanosis in your gums. Your gums are pink. Your tonsils are absent. Your uvula is midline. Can you stick your tongue out? Great. Your tongue is dorsal pink, and there's a little white coating present. It's moist, roughened, and the ventral surface is smooth. It's glistening with veins, and you do have saliva present, which is all normal. Okay? No irritation, and I didn't see any abnormalities. I'll get it one more time. No abnormalities or redness. Okay? Great. And no chipped or cracked teeth. Okay? So now we're going to go to palpating your thorax. So I'm going to palpate with palms of my hands. Your chest wall noted to be smooth, warm, dry, no lumps, lesions, or any other kind of skin abnormalities noted. Your anterior and posterior to transverse diameter is 1 to 2, which is normal. Your spine is midline. It's in S-shaped on the lateral view. No lumps or pain upon palpation, right? Mm-hmm. Great. Okay. So now we're going to be assessing for a tactile fremitus, okay? So I need you to turn this way, kind of cross your arms over, kind of like Indian, there you go. So I'm going to place my hands right here, and can you just repeat the number 99?
99.
Great, so no tactile fremitus noted upon palpation, okay? So now we're going to palpate your chest expansion. So I'm just going to put my hands right here. Just give me a big, deep breath. Great. So they're both rise symmetrically, which is normal. I'm going to listen to your lungs. Start right here. In and out. In and out. In and out. Now we're doing it in all 7 areas. In and out. Great. And the lung sounds are clear bilaterally in all fields. No adventitious breath sounds and vesicular sounds are present in the peripheral lung fields. So let's listen to this breath, just to make sure. In and out. In and out. In and out. In and out. And I will do all 7 on this side too, okay? They all sound normal. No adventitious breath sounds. I'll walk to the back, but I'm just going to percuss 2 areas of the lungs. And the sound is low-pitched and hollow, which is normal. Sorry, I didn't do so much. Okay. So now for your cardiovascular, I'm going to inspect. There's no pulsations, lifts or heaves. Breathe in and out for me. Visible, none visible over the pericardium. I'm going to show where the right sternal border, the left sternal border, and the midclavicular line are. So this would be your right sternal border, your left sternal border, and your midclavicular line is right here in the middle of your clavicle, down at the fifth intercostal space. So I'm going to 5 areas to listen for heart sounds are going to be, the first one's going to be your aortic, okay, which is at the second intercostal space on the right sternal border. Pulmonic is at the second intercostal space at the left sternal border. Erbs is at the third intercostal space at the left sternal border. Tricuspid is at the fifth intercostal space at the left sternal border. And the mitral, which is your point of maximum intensity, is at the fifth intercostal space at the midclavicular line. So I would palpate, okay, and then I would auscultate with the bell, so I would just squeeze a little bit harder, because this is a cardiac stethoscope for the bell, and the PMI is not palpable, and it does have a regular rhythm, no extra heart sounds or murmurs are noted. So not always, but typically, your S2 is more accentuated in your aortic and pulmonic valves. Your S1 is accentuated more in your tricuspid and your mitral valves. Your S1 should equal your S2 at the Erbs point. So the next thing we're going to do is assess your peripheral vascular system, okay? So we're going to inspect your arms and your legs, your feet all at the same time, okay? So for skin, your integrity, and you've already tested this for your temperature, and so it's all pink, and it's warm to the touch, and the hair is all evenly distributed. I'm going to check for varicosity, so I'm going to have the patient stand up. Put the bed down a little bit. Okay. There we go. So I'm going to pull the pant leg up. And there are no varicosities noted. No. Great. Okay, so now you can sit back down. Okay, so now we're going to be checking your pulses bilaterally, okay? So at first we're going to check your brachial and your radial and your popliteal, your femoral. Down here it's going to be your dorsalis pedis, your posterior tibial. So all the pulses were regular, which is 2+ on a 0 to 4 scale. They're all regular, and I'm going to palpate for edema. So no edema noted on either leg or feet bilateral. Great. Okay, I'm going to move this, and I'm going to get you to lay down, because I'm going to be assessing the abdomen. Okay? So your abdomen is pink. It's intact. There's no scars or piercings noted. No stria or lesions, pulsations noted. No abdominal distension. No visible peristalsis noted. Your umbilicus is midline, and it is inverted. It's not exverted. I'm going to look down at this angle, and the abdomen is flat. It's not round or distended. I'm going to auscultate all 4 bowel sounds, all 4 quadrants. Okay? And I would listen for 1 minute. Normal bowel sounds are between 5 to 30 per minute. So I listen to each quadrant, all 4 quadrants for 1 minute. Bowel sounds are active in all 4 quadrants. No vascular abnormalities auscultated. Now I'm going to just palpate and name an organ in each quadrant of the belly. So your right upper quadrant is going to be your gallbladder. Your left upper quadrant is going to be your spleen. Your right lower quadrant is your appendix. and your left lower quadrant is your sigmoid colon. Okay, great. Everything is normal. You can sit up for me. Do you have any questions for me?
No, thank you.
That was a great assessment. Thank you for being my patient. So, have a great day.
You too. Thank you so much.